So hi, today we're going to be going over the exercises that are going to be given to you prior to your thoracic surgery. And these are exercises that are going to be given to you to perform at home. And we're actually going to be having you come into our outpatient program as well. You'll be coming in 2 days a week and performing these exercises, among others, supervised, but we're also going to be asking you to complete some of the exercises at home. And you'll be doing these exercises every single day between the time that you start your rehab and the surgery day. So it's really important that you perform those. You'll each be given a band or a tube, something that looks like this, and the band will be a flat piece of rubber that won't have any handles on it, but it still operates the same. And we're going to be going over some exercises today, both upper body and lower body exercises that you'll be given, and we're going to go over each one of them right now. So we'll start off by demonstrating some of the upper body exercises. We'll be using the tube to complete those. Each one of these exercises you'll be able to complete either sitting or standing. We prefer them you do standing. If you absolutely can't stand, then you can go ahead and perform these seated. Part of the exercise is to keep your balance as well. So that's the preference in completing these standing. So the first exercise we're going to be doing is called a chest press. And you're going to take your band or your tube and you're going to put it behind your back. And we're going to want to make sure that the band is under your arm, so in between your arm and your side here, kind of right in your armpit, right about chest high. I'm going to take a stance that's approximately shoulder width apart, with slightly bent knees. I'm going to grip the band so that the band is slightly tight, and I'm going to go ahead and press with bent arms all the way out till my arms are straight directly in front of me and back, always under control. I want you to coordinate your breathing with these and make sure you're always exhaling on the exertion part, or when we're pressing this exercise. So it's exhale and inhale and back. All these exercises are going to be done the same way by performing them 10 repetitions, and we're going to ask you to do these 3 sets of each of these exercises, meaning that we'll do 10 repetitions, a little bit of a rest, additional 10 repetitions, and we'll do that 3 times. Again, we could do this exercise seated. I'm just going to show this one standing. The next exercise is called an overhead press. And for this one, it's really going to depend on the length of your band. So I'm going to show this one seated. So I'm going to go ahead and have a seat on the edge of the chair, making sure my back is away from the back support. And I'm going to go ahead and put the band or tube under one foot. I'm going to grab the band right up here and pull my elbows bent and my hands at shoulder level. I'm going to sit nice and tall, and I'm going to go ahead and press to the very top so my arms are extended above my head. And again, coordinate that breathing will be exhale and inhale. Exhale, inhale. And again, we can repeat that one 10 times over 3 sets. If you're unable to do that or your band's a little short, what we can do is perform one arm at a time. And what we're going to do is lay the band on the floor. I'm going to go ahead and put one foot over top of it. I'm going to go ahead and bring my one arm into that same position, kind of balance and my weight between both feet, and press to the top. Exhale and inhale. And for this one, we'll do 10 repetitions for each arm, so we'll have to do that one for both sides. The next exercise we're going to do, now we're going to switch to the pulling exercises. The first one we're going to do is a lat pull. And for this one, I'm going to ask you to grab the band or tube with about 15 inches, maybe 20 inches apart, where you're going to extend it over your head to start off. Okay? So your arms are going to be extended. What I'm going to ask you to do, take a nice supportive stance, and we're going to go ahead and stretch the band down and outward so that your hands and arms are facing in opposite directions, back to the top. So for this one, I'm going to stretch the band and exhale and inhale. This one will make it easier the more distance there is between your hands, and the more difficult the closer your grip would be. So that's your lat pull. Again, 10 repetitions, 3 sets. The next exercise is a row. So again, we're going to be pulling. And for this one, you're going to need a fixed point. I'm going to show this one seated. And we're going to be using this bar here as my fixed point. I'm going to go ahead and wrap the bar, the band or the tube around the bar. I'm going to sit on the edge of my chair again, nice and tall, back away from the support. And I'm going to go ahead and grab where my arms are extended and the band is still, there's no slack in it, it's still tight. Okay? This is important because we want to make sure that your arms and your band are right at chest level. Okay? And this exercise is performed by pulling your arms in a bent position and your hands back to your chest, like this. And extend all the way back out. And this one, what I'm looking for is feel like I'm squeezing my shoulder blades together and relaxing. So the breathing for this one is I'm going to exhale as I pull, inhale as I release. If you want to perform this one standing, you're going to want to make sure you have a higher fixed point. And a doorway works really well, where you can take your band and put it in half, put it in the open part of the doorway, and close the door on it to create a fixed point at that chest level point there. So that, again, we're going to perform that one 10 repetitions, 3 sets, and that'll conclude your upper body exercises. Your lower body exercises are going to be fairly simple. We're going to be using a chair to perform a sit to stand that is fairly self-explanatory. My feet are going to be just under my knees, so I don't want them too far out or underneath of the chair. So the feet are going to be flat on the floor, and you can use your arms to either press from your legs if you need to. If you don't require that, I'm going to ask that you put them out in front of you. The first portion of this exercise is I'm going to have you actually lean slightly forward so you feel your weight shift onto the heels of your feet, and then we're going to stand up. And back down again, by sticking my butt out, nice and controlled, back to the chair. Lean forward, drive from the heels, and back down, nice and controlled. The key for this exercise is making sure that your knees don't go over your toes, that they stay pretty much in a fixed position. So we don't want them to go over and up, or when we sit down, we don't want those knees to go forward. We're going to really stick our butt out and sit down nice and controlled. If that's too hard, we have an alternative for you where you can go behind your chair and you can place your hands on the back of the chair for balance. Get a nice wide stance, a little wider than shoulder width for this one. And what I'm going to have you do is stay nice and tall, back straight, neck straight, and lower yourself down into a squat position using the chair for balance. And when you get to a comfortable position, or a position you feel is at your threshold, you're going to drive from your heels and go back up. Okay? For this one as well, you're going to really want to make sure that those knees stay behind your toes. So we don't want those knees to go forward. We're going to keep our weight on our heels, squat down, use the chair for balance, and back up. Again, the breathing portion of this, the driving of the upward motion is our exertion. So we're going to squat down, we're going to exhale, drive up, inhale on the way back down. And the breathing combination will be the same for the sit to stand as well. Our last exercise is going to be a seated march. It's going to be for this core area. Again, same position from the seated position. Please make sure your back is away from the back support. We don't want to be resting here. We want to be engaging these muscles. You're going to want to sit in that same position as you took for your sit to stand. And what you're going to do is, for this one, is lean back ever so slightly. We're still off the back of that chair. And that's just to engage your abdominals and those core muscles. And I'm going to ask you take your hands and just put them directly down by your side. And one leg at a time, we're going to march to the point where the back of your thigh comes off of the chair and back down again. And repeat with the other leg and back down. Another key for this exercise is to make sure you keep a light contact with the floor. So your feet should not be resting on the floor and going back and forth. I want you to lean back, engage yourself here to the point where you're really feeling your abdominals are nice and tight. Arms down by your side, march, tap the ground very lightly, and repeat with the other leg. And for this exercise, you're going to want to perform it 10 times each leg, or you can just count to 20. And again, we're doing that over 3 sets. So those are the exercises we're going to ask you to perform every day prior to your surgery. You'll be coming in and visiting us 2 times a week in our outpatient rehab program, and we'll be reinforcing these as well. If you have any questions, we want you to let us know, and if you have any issues where we can modify these exercises for you if you're having other difficulties. So thanks for your time. We look forward to seeing you. Thanks.